This is Board President Doyle. We are resuming meeting following break. We will now re-enter policy review with staff member Davis. Again, I remind everybody to identify themselves as board or staff member with last name. We're going to be speaking one at a time. Staff member Davis will be facilitating a roll call with my assistant since she's working virtually today. As we go around in the round robins, each person will be called on. If you do disagree with a comment, please withhold your comments until it's your turn. Everybody will be given a chance to speak again. Again, comments should be limited to 3 minutes per board member. We now will be resuming conversations with package number C1. Staff member Davis.
Morning, Staff Member Davis. So again, I apologize I can't be there in person. You probably are glad I'm not. If at any time my voice gives out too much, just please let Staff Member Melvin know, and we'll have someone in the room take over facilitating policy discussions. So for today, this is discussion item C1 related to vaccinations. This is the board's first review of the proposed rule language for revision of rules to permit a pharmacist to administer an influenza vaccine to persons who are 6 months of age or older, starting on January 1st, 2024. And that's pursuant to 2023 House Bill 2278. And the rules also permit a certified organ pharmacy technician or pharmacy technician to administer a vaccine under the supervision of a pharmacist beginning January 1st, 2024, pursuant to 2023 House Bill 2486. Later in this meeting, the board will be considering a rule package C2 that incorporates the similar language to what we're going to go over today, which is necessary due to these two bills to have the language corrected in divisions 115 and 125 for the new pharmacist and COPT and PT divisions. So for today, the board will consider sending the proposed rules for this package to the November 2023 rulemaking hearing to potentially adopt in December and be effective on January 1st, 2024. So this is the board's first review of these rules. There should not be there's not many yellow highlights. There were some minor changes that we made since we initially drafted the package. It was included in your August 2023 board packet for review, but due to time limitations, we were not able to discuss it. So a little lay of the land before I get started. There's a reason we are in the process of updating all the licensee rules. The board adopted most of Division 115 at the August 2023 board meeting to be effective on March 1st, 2024. However, the rule related to vaccine administration was not adopted, and we will be discussing it in mailing C2. Because the law goes into effect before Division 115 will become effective, or Division 125, it is necessary for the board to update current rules in Division 19 and 25 to comply with the new laws. In drafting these rules, board staff attempted to reorganize the rules, update the language needed due to the law, and not propose to amend the rules if it wasn't required by the law change. So there's a very tight dance that we're walking here. The rules as they currently are on the books in Division 19, specifically about immunizations, they were in need of an update. And so we're trying not to update things we don't have to update, realizing that these rules will only be on the books for a few months, but making the changes that are necessary. Unfortunately, the rules are kind of a mess. And so we tried to do this with as light touch as we could, but we still had to touch quite a bit. So I'll walk through them with you starting now. So 855-019-0270. This rule is supposed to be about pharmacist qualifications to vaccinate. That's actually the title, is qualifications. Paren 1 is an intern rule that's in the pharmacist rule division. Staff proposed to move this rule later in the package and then reframe it in the lens of the pharmacist's responsibility when supervising an intern and at the same time supervising a certified organ pharmacy technician or pharmacy technician. Paren 2 addresses policies, and thus staff proposed to move this rule into 855-019-0280, which is actually about policies. So what was Paren 3 now becomes Paren 1, and it will read, a pharmacist may administer vaccines if the pharmacist has completed a course of training approved by the board and maintained competency that includes injection site and cardiopulmonary resuscitation, CPR, specific to the age and population of patients being vaccinated by the pharmacist. So the new Paren 1 is the first rule that actually addresses qualifications. It changes treats to patients being vaccinated, as vaccination is not a treatment, it's prevention of a disease. Paren B reads much the same as before, holds active CPR certification issued by the American Heart Association or American Red Cross or other equivalent program intended for a healthcare provider that contains a hands-on training component and is not valid for more than 3 years. And this rule, there is already a rule about documentation that's in 855-019-0290. So we propose to strike the last sentence of what is now Paren B. Old Paren D, we propose to strike. There is already a rule requiring the pharmacist to follow protocols in the next rule, which is 019-0280. Remember, this section is really supposed to be about qualifications for a pharmacist to provide a vaccination. Paren C, just changing the language a little bit to say has access to a current edition of the CDC's reference. Epidemiology and Prevention of Vaccine Preventable Diseases. Paren 4, striking Paren 4 completely. Paren 4 is not about qualifications, and it's been moved into the next rule, into 19280. And Paren 5 is no longer true, and it will be addressed in the next rule, 855-019-0280. So really just trying to clean up this rule to focus it on the qualifications for a pharmacist to provide vaccination. I'm going to give it back to you, Board President Doyle, for any board discussion before moving to the next rule.
Board Member Doyle, thank you. Board Staff Davis. We'll go around the table with regard to comments and questions specific to Rule 855-019-0270 as reviewed by Staff Member Davis. Board Member Chin.
Member Chin thinks it looks pretty dang good.
Member Hall.
Board Member Hall, no comment.
Member Joyce.
Board Member Joyce, no. In regards to pharmacists and qualifications, I have no additional comment.
Member Viberman.
Board Member Viberman, I think it looks great.
Board Member Hemmons.
No comment.
Member Beeman.
Member Beeman, I'm comfortable with it.
Member Patel.
Board Member Patel, I'm good with the current pharmacist qualification, but just want to be clarified. So according to this, the pharmacists do not require to have that ACIP training and keep the records in the pharmacy. Did I understand right? Or I'm still required to do that?
This is staff member.
Okay.
I can address that. Staff Member Davis. So the current rules are pretty vague about what training the pharmacist must have. It just says has completed a course of training approved by the board and maintain competency. The board has never actually approved any courses of training, but in general, the major courses that are approved by the CDC, which is like the APHA pharmacist immunization training, have always been accepted as training. But there's not specific with what you're thinking of, like with the PrEP Act, where it was very specific about what had to be You'll see a little bit more specificity in the new rules for 115, but again, we're just trying not to touch something if we don't need to.
No, I'm good with it. This is board member Patel again, and no, I'm totally fine with it. If you keep it open, I think that's going to prevent a barrier to access healthcare and immunization. So don't touch it. Looks good.
Board Member Doyle, no substantive comments. Board Staff Member Davis, please continue.
So we'll move to OAR 855-019-0280. And this is vaccination protocols, policies, and procedures. So some of the language you just saw that we struck a lot, you'll now see down here in this section. So in paren 1, prior to prescribing, administering, or dispensing a vaccine, a pharmacist, paren A, until January 31st, 2024, must follow protocols written and approved by the Oregon Health Authority for vaccines and the treatment of adverse events following the administration of a vaccine. Paren B, effective February 1, 2024, must follow a statewide drug therapy management protocol per OAR 855-020-0300 or a collaborative drug therapy management agreement per OAR 855-019-0260. So paren 1 has been modified to be clear that a pharmacist can prescribe or dispense a vaccine, such as oral typhoid. And this also combines with paren 6, which is later in this rule and I haven't gotten to, but it currently says the pharmacist may prescribe, administer, or dispense immunizations, including oral vaccines, as established by written protocols approved by OHA. So we've kind of combined 6 into 1. In addition, included in this mailing is C10, is a proposed rule and protocols to move the vaccination protocols from authorship and publication by the Oregon Health Authority to authorship by subject matter experts, including OHA and licensed pharmacists, review by the Public Health and Pharmacy Formulary Committee, and review and rule adoption by the board. Utilizing this process will be consistent with all of our other statewide protocols that are referred to the board by the PFAC, is the short name for that long name of a committee. Thus, paren A maintains the status quo of following OHA protocols, and paren B transitions the protocols to the statewide protocol recommended to the board by the PFAC or permits the use of collaborative therapy management agreements. We're going to have a more kind of robust discussion about the deadlines and timelines and when we talk about C10. And so if at that time the board makes a different decision, then we'll go back and modify this language. That's why we're going to hold motions for all C1, C2, C10, and C11 all together so that we can make sure everything meets the directives of the board. In paren 2, a pharmacist may administer vaccines, paren A, to a person who is 7 years of age or older, paren B, to a person who is 6 months of age or older if the vaccine administered is an influenza vaccine, and paren C, to a person who is at least 3 years of age when, and this is current language, the governor declares a state of public health emergency, or B, the public health director during a declared disease outbreak reduces the age limit. So paren 2 was language that we really just pulled from the rule above. Remember, under the qualifications, it was telling us who you could immunize, and that's not a qualification, that's a policy and procedure. And then we struck paren 3. The pharmacy must maintain written policies and procedures because this is an outlet requirement that's in the pharmacist rules, and we've moved it to an outlet rule later in this package. It's also important that the rules make clear the steps of the vaccination process that the pharmacist is responsible for. And the additional rules in this section are proposed to provide clarity to pharmacists, keeping in mind that an intern can administer and now a certified Oregon pharmacy technician or pharmacy technician can administer. But I want to stop here after paren 1 and 2 and let President Doyle gauge the board for discussion and before we move to paren 3.
Member Doyle, thank you. Staff member Davis, we'll go around the room again, asking for comments specifically to 855-019-0280 for Ren 1 and for Ren 2. Board Member Hall,
Member Hall, no comment.
Board Member Joyce,
Board members, no, it looks great. Looks like we're in line with the public health standards.
Member Viperman,
No comment.
Member Hemmons,
No comment.
Member Beeman,
Board Member Beeman, I appreciate the clarity. Thank you.
Member Patel,
Board member Patel, I am good, but if you go to Ellen 3, and it says that
We wait on for Ren 3.
parent 2, but I think it's in the 2, I think, sorry, I lost my page, but it says like you have to perform the verification prior to administration of vaccine.
That's in paren 3. We'll talk about that in just a
That's
moment.
fine. Okay, sorry, thank you.
Board Member Doyle, no comments.
Member Chin has no comment.
Go ahead, Staff member Davis.
Okay, so now for paren 3. A pharmacist who administers or supervises administration of any vaccine must, paren A, make vaccine recommendations. Paren B, select each vaccine to be administered. Paren C, ensure compliance with paren 1. This had previously stated prescribe each vaccine per OHA protocol, but again, with the updated language, additional scenarios may apply. So we just opened up this language to say ensure compliance with paren 1. Paren D, ensure the appropriate vaccine information statement is provided to the patient or legal representative prior to each dose of vaccine. We've removed a lot of the additional language there. As federal law does not require the person who is administering the vaccine to personally hand the VIS to the patient or ensure that the document is read to them prior to administering the vaccine. The vaccination protocols do require the pharmacist to provide the current VIS statement and answer any of the patient's questions. Paren E, perform verification prior to administration that includes but is not limited to prescription order accuracy verification and vaccine product accuracy review. Paren F, advise or counsel on the therapeutic values, contents, hazards, and use of each vaccine. Paren G, manage adverse events. Paren H, report adverse events as required by the Vaccine Adverse Events Reporting System or VAERS and to the primary care provider as identified by the patient. Paren I, verify accuracy and completeness of documentation for vaccine administration. And paren J, ensure all persons administering vaccines under their supervision are appropriately trained and qualified. And we've removed paren 6 because we had already incorporated up into paren 1. So now, Board Member Doyle, if you'll do a round robin for this.
Member Doyle, thank you. Staff member Davis. We are now speaking about paren 3 specifically. Board Member Joyce, any comments?
Board member Joyce, it looks clear.
Member Viperman,
Member Bivderman, yes, I have a question. I was wondering where, the part is that you have to check with the before administration, don't you have to check with alert? Is that,
Staff member Davis.
Staff Member Davis, that's included in the protocol instructions. It's not something we currently have in rule. And again, we were trying not to put rules into place that weren't already, but the protocol does require that.
thank you, I knew it was a need to do, I just wondered why it wasn't in here. Thank you for your clarification.
Member Hemmons,
Member Hemmons. We're not at 1:30 yet. Okay, I have no comment.
Member Beeman,
Member Beeman, no comment.
Member Patel,
Board Member Patel, yes, so subsection E, it says perform verification prior to administration. That includes but not clarify what is their intent, like perform verification. So, sometimes you go to the mass immunization or you go to long-term care facility. So I know you check your consent form, but you meant a pharmacy, they have to do the actual verification before you give the vaccine. You meant just go through the consent form and administer the vaccine.
Staff Member Davis.
Yeah, so I can kind of give some background as to why we chose this language, and if we need to modify it, we definitely can. The idea is that when the technician, remember writing this under the lens that someone else would likely be administering, prior to a technician or an intern giving a vaccine, the pharmacist has to make sure that the order is accurate and that the product selected for injection into the patient is correct. So that's what we were trying to get at. If the language isn't quite right, let us know, but that's.
Member Patel.
Board Member Patel, thank you for clarification. So in that case, I think we should write down along the line that if it's not the pharmacist, then it must be performed verification prior to administration, because I'm thinking as a scenario, I'm the pharmacist going to long-term care facility and one of the patients say like, hey, sorry, I missed to give my consent form before, but I would like to have immunization right now. I can check on my alert and then patient is eligible, but I'm not going to perform verification in my pharmacy that time. So I don't want to say no. You know what I mean? Go to
Staff
the
member,
consent form. Go ahead.
just a clarification, are you interpreting in paren A prescription order to be like the typed prescription at the pharmacy, or are you interpreting that to be like the patient's consent form and the patient has said, this is what I want, and you're confirming before you give them the vaccination that the order, which is that consent form, is correct?
Yeah, so I'm thinking about consent form is right. Alert say yes, patient is eligible. But if I read this language, it says perform verification prior to administration to me, or maybe it can, licensee can interpret that you have to perform final verification in your pharmacy before you admit the vaccine. I need clarification on that for me and for licensee as well.
Give me just a second. I was going to pull up our definition of verification. In OIR 855.006.0005. So verification means confirmation by the pharmacist of the correctness, exactness, accuracy, and completeness of the acts, tasks, or functions performed by an intern, a certified organ pharmacy technician, or a pharmacy technician. Do any other board members feel that that language is unclear? And do you have a suggestion for alternative language?
Member Doyle, please raise your hand if you have a comment to Staff Member Davis's question. Member Patel, do you have some alternative language that you'd like to propose?
Board Member Patel, no, if no one has question, if everyone understood, and if we clarify that that's not our intent, if you go to the mass immunization, if you go to long-term facility and you have consent form, you can give immunization. I'm fine with it, but I don't want to get a case.
Yeah, no, I think it's not the rule isn't specific about where it's happening. And I think the pharmacist must perform verification not specific to where it's happening. So as long as you perform verification that what you're about to give that patient is what they consented to, and you've got the right product in your hand, that would be in compliance with the rule.
Board Member Patel, if everyone agrees, I would just say, if you ask for addition, I would say perform verification of consent form prior to administration.
Staff Member Davis, any feedback on that?
We don't typically put the consent forms in the rule, and I think leaving it open gives it a lot more opportunity to be whatever it is. If it's performing verification, that if the doctor wrote a prescription, the pharmacist is administering off a prescription, whether it's a consent form, but just that verification has to occur. That's the right product that's been selected and the actual physical product is correct.
Board Member Doyle, thank you, Staff Member Davis. Board Member Chin.
This is Board Member Chin. The mass vaccination in facilities was happening for years. Is there anything you're doing differently that's not clear? This in what's written is what I'm trying to discuss, because this, we're doing it all the time now. They're doing verification. They're doing it whichever mode, whether I've written a prescription or the patient has consented to that through the facility. Is there anything that's written here that's not clear about what you're already doing?
Board Member Patel.
Board Member Patel, we are doing it mass action. We go to the long-term care facility also. It's just this language. I don't know, this one is added language. So in the previous language, I think you're fine, because I don't think so it was there that you have to perform verification prior to administration, right? So, or it was always in there.
You always, this is.
No, I'm saying the consent order, you always do that. But what I read, the perform verification, and you're verifying the prescription order, not the consent form. There's two things I'm talking about.
Board Member Doyle, again, to remind everybody, the potential motion for this at the later time will be setting the rulemaking hearing, and we can get additional public comment if there is concern on this particular line item. Staff Member Davis. Proceed.
Did we go all the way around? Did everybody get a chance to talk about?
Board Member Beeman.
I remember Beeman, I think in reading it, rereading it, when you look at E and then read includes but is not limited to, it explains the type of verification that should be occurring and in theory does occur. That you're making sure that the prescription order accuracy, that is the consent form. In most cases, without using such a specific term as consent form. So I found it clear. I think the word verification has become utilized in other ways that we can't use it for its true dictionary meaning sometimes because of how it's used in other ways that we think about. But in this case, you are verifying. Yes, this is, you're verifying what you need to before administration. It's not verification in the sense of, is it typed correctly later? But I found it A and B to clarify E. I do look forward to hearing public comment on it because sometimes we get some wordsmithing that we don't think of on the spot. It's helpful.
Member Doyle, are there any other comments from the board? Please raise your hand. Seeing none, Staff Member Davis, please proceed.
Okay. Now we'll move to paren 4. An appropriately trained and qualified pharmacist may permit an appropriately trained and qualified, paren A, intern to perform the same duties as a pharmacist, except as prohibited in 855-019-0200, paren 6. That rule is the current rule that permits an intern to do any task that we listed earlier in the rule, as long as they've completed their first academic year. So this would just maintain the status quo. Paren B, an appropriately trained and qualified pharmacist may permit an appropriately trained and qualified certified organ pharmacy technician or pharmacy technician to conduct the physical act of administering a vaccine in accordance with OAR 855-025-0024. And that's a new rule that we're going to cover shortly with all the qualifications that are necessary for a COPT or PT to administer vaccinations. In paren 5, an appropriately trained and qualified pharmacist who is supervising an intern, certified organ pharmacy technician, or pharmacy technician in administering a vaccine must be immediately available to the vaccinator. Paren 5 is similar language that we see in the PrEP Act requirements. I made a couple grammatical changes. That's what the yellow highlights are, just to make it read a little bit more easily and to make it more consistent with the law that contemplates the administration of a vaccine. I know there's probably not too much discussion we can have about this until we actually talk about the tech rule. But do any board members have any questions? Board Member Doyle?
Board Member Doyle, I go around the room and ask, Board Member Pipperman regarding para 4.
Member Bipperman, just so I know that we are going to discuss this, and if rules change, it will affect this as well.
Staff Member Davis.
I'm not sure what the question is.
So we're going to discuss this at some other time about the training and all that.
Oh, it's coming up in a minute.
I know, I understand. Just so long as we're going to talk about that, then I'd have no questions.
Okay.
Member Hemmons.
Board Member Hemmons, just a point of clarification for me. For number 5, where it says must be immediately available to the vaccinator, that means that the pharmacist who is supervising, for example, a pharmacy tech who's who's going to administer vaccine would have to be physically present while the pharmacy tech is administering the vaccine. What does it mean by made available?
Member Davis.
Physically present in order to help respond to any emergencies that might occur.
Okay, so Board Member Hemmons, physically present means just physically present in the pharmacy or physically present next to the whoever is administering the vaccine, or they just have to be around somewhere? Doesn't mean by physically present.
Well, yes, Staff Member Davis, vaccines can happen in a lot of different places, so we don't want to say must be in the pharmacy because it could be happening in a nursing home, and so that's why the language of immediately available to the vaccinator, wherever the vaccinator is, the pharmacist who is supervising them must be immediately available to assist.
Okay, so Board Member Hemmons again. So in theory, you could say, available by pager. It doesn't say physically present, right? It just says has to be available. So it could be like in a large institution, like a hospital setting, or a nursing home. It could be just available by pager or some kind of other electronic system, pager, right? Based on what this says.
Remember Doyle, that could be a reasonable interpretation. If there is no statement here that I'm seeing that says physically present. Is there language that you'd like to offer to change?
Remember, I'm just trying to clarify what it means when it says immediately available. I heard physically present. And physically present doesn't necessarily mean in close, what kind of proximity to the, vaccinator. So basically, where I interpret this is they just have to be available, be in a position where they can respond immediately. They don't necessarily have to be physically present with the vaccinator. That's how I interpret this. So if you're in a nursing home and let's say tech is in a room with a resident given a vaccination, the pharmacist would just need to be somewhere where the tech has the ability to page them if something does happen. That's the way I interpret that. Is that correct? Okay.
Thank you, Staff Member Novel.
Staff Member Shovel, I was going to offer similar comments to Board Member Hemmings. Immediately available to respond in the event of an adverse event, or in the case of an adverse event, something like that. To imply that it's physical presence, not telephone presence, or something that would not allow them to be immediately able to respond to the patient.
This is Staff Member Davis. I think it's a very important point that you're bringing up, Board Member Hemmings. When the law was enacted, it did not permit a pharmacy technician to administer emergency medications. It only permits them to administer vaccines. And so it's very important that a pharmacist who can respond to an adverse event be very immediately available. So we want to make sure this language is quite clear. And I'm very responsive to any language changes that you might have.
Board Member Hemmings, yeah, I'm just thinking that when it said immediately available, that's it's not really, it's a little bit vague. And then I have a question about the terminology about under the supervision of a pharmacist. It was further up, right? So this can only be done under the supervision of a pharmacist. And supervision means physically present or just written that I'm supervising you, right? You've been supervised by me, not necessarily actively being supervised at the time that you're doing the administration. You understand what I'm saying?
Yeah.
When you say supervise means, yes, all techs are supervised by pharmacists. We know that in theory. But in this situation, when the tech is administering a vaccine, the supervision also means that they're actually being, we go back to that again, being supervised at the time that they're doing the vaccine in an active way, active supervision versus passive supervision, I guess is what I'm referring to.
Yeah. Staff Member Davis, we have a definition for supervision by a pharmacist in OAR 855-006-0005 paren 53. It means being stationed with and within the same work area, except as authorized under our telework rules, as the intern certified organ pharmacy technician or pharmacy technician being supervised, coupled with the ability to control and be responsible for the intern certified organ pharmacy or pharmacy technician's action.
Board Member Henderson, thank you for that clarification. So then I go back to in a nursing home type setting, where the tech is in a residence room administering a vaccine. I would assume based on what I've heard that the pharmacists would need to be present, not just somewhere in the building.
I would agree. Pharmacists could be maybe in the hallway. They're immediately available.
I guess my point is this, Board Member Hemmings, is that I think the word immediate available is subjective. That's what I'm trying to say. It's very subjective, right? Because if you can page me and I'm immediately available, am I really immediately available, right? What does immediate mean? No, I'm splitting hairs, but it just stood out to me because I didn't understand what that meant. And in the context of thinking about the supervision piece, the active or passive supervision, And in this case, it would be passive supervision, not active if you're not present.
Member Doyle, thank you. We'll continue the round robin with Board Member Beeman.
Member Beeman, I see. Remember, I don't have any better language. But I'm comfortable with the content, and I think it's long, and again, I refer to comments we're making.
Michelle?
Board Member Patel, yes, excellent point by Board Member Hemming, yeah. And I think the whole, if I understand and what I interpreted as a pharmacist, that as long as pharmacist is available to take care of that adverse event, that was the whole goal, because giving injection in less than 30 seconds, that is not much, but if someone has an anaphylaxis reaction or something, then an technician is not equipped to handle that situation, and that's supposed to be handled by a pharmacist. That was the intent, but I can see that you can think different way, immediately available means. And I think we are making this rule based on this statute that now technician give vaccination, and that we are going to discuss later. I'm just kind of interested what our statutes say, that it has to be supervised, it has to be immediately available vaccinator. That's what I was wondering. But thank you.
Board Member Doyle, I don't have any concerns with the language at hand. Webster's dictionary provides a definition of immediately as without time interval, AKA straight away, or in direct connection or relation to, i.e. directly. So it seems as if the pharmacist, wherever the pharmacist may be, will have to, or the word be immediately available right then and there. Board Member Chin.
Member Chin is reflecting back on Executive Director Schnabel's recommendation to just add the wording after available to the vaccinator for adverse vaccine event. Really tell you what the immediate was in terms of Webster's definition. It happens immediately. It's gotta be right there. So that would, to me, maybe clarify what all of that means, because that's what the whole purpose of that statement is.
Member Hall.
Member Hall, I agree. Adding something at the end just to kind of clarify. But other than that, I'm okay with everything else.
Member Joyce.
Board Member Joyce, yeah, that was a concern for me as well, the language in that, as far as immediately available, but I did share the same thoughts as Executive Director Schnabel, adding in case of an emergency, be available. That I'm thinking we're going to discuss this later, but are we expecting, because the technician is going to be doing the physical act of the vaccine administration, are we expecting that technician to also monitor any adverse events? And how I mean, that's kind of like a clinical judgment, looking to see if the patient is having an anaphylaxis reaction or just syncope or whatnot. Is the expectation for the technician to watch for those symptoms if the pharmacist is not physically there? So I don't know if we're going to discuss that later or here, but that was a concern of mine.
Thank you, Board Member Vipperman.
Board Member Vipperman so appreciates Board Member Hemming's comments. As a public member, I think that's how the public's gonna look at it. And I am in agreement with perhaps adding that wording for the adverse be available for adverse
X or something similar. Yeah, that's my comment. I also am concerned about, board member Joyce's, but again, I saved my comments for later, so.
Member Beeman?
Member Beeman, I'm not in favor of adding for adverse event, I guess for clarification. And I'm just one person, but there's other reasons to have the pharmacist immediately available that can happen prior to administration of the vaccine. There can be either patient preferences or questions that arise, or if somebody has a significant scar in the area, am I to inject through that skin or should I inject? Oh, this is, there's a lot of things that are one-offs that are unique, because each patient is unique, that I think the adverse event statement is too limiting. And again, I wish I had better language to make this clearer on the paper, but immediately available is not just adverse event. There's a lot that can happen before that would need to be clarified. Prior or just before, once all pharmacist pieces are done, then that actual administration is to occur. So I'm not in favor of just listing adverse event, but
Staff Member Schnabel?
Staff member Schnabel. I think if you add something like to respond to adverse events, it's not limiting to adverse events, but that being the worst case scenario would require you to be close enough to respond in case there was a question that was not an emergency situation. So I think it wouldn't preclude any other type of contact being made between the technician and the pharmacist, but to respond to adverse events, that's clearly the most serious scenario that could occur, and that any of the other things that may come up that are less serious would also be able to be responded to immediately in that event. So I kind of think it could still be added and not limit what kinds of things the pharmacist would be able to do.
Member Doyle, Staff Member Melvin, can you add that language statement?
This is Staff Member Davis. Please change the word events to reaction. That's what it's called in the protocol.
Yeah.
I think it would be confusing.
Yes.
Member Emmons, is it okay if I do a round to see who approves that new language? Board Member Chin, do you agree with adding that language as presented on the screen before us?
I do.
Member Hall,
For Hall, yes, I agree.
Member Joyce? Joyce, yes. Member Zipperman,
Board Member Peppermint, yes.
Member Emmons?
Board member Hammond, I don't necessarily disagree. I just kind of, I agree with what board member Beeman just said, that it could be interpreted that that's the only reason why you would need to be immediately available. But I'm on the fence about that.
Member Beeman?
Board Member Beeman, I'm not totally in love with it, but I think it provides the clarification that we're looking for, that we are meaning physically immediately present. So I can go.
Member Patel?
Remember that, I would prefer open-ended and not include that language to respond to adverse reaction, because yeah, it's licensing. I can see that that's the only one reason. So I would like to keep it open.
Board Member Doyle, my comment is to not add it, but we have 4 in favor, 2 with limited support and 2 not support. So we have consensus to keep the language as presented in red. Are there any further comments or questions with regard to para 4 and para 5?
This is Member Hammond, just for clarification. How did you come up with 4-4? I mean, that is top, well, not, we're not voting. But I thought there were, everyone over here, well, everyone over here kind of thought of, is yours considered a vote? There's 4, so how is it?
Board Member Doyle, I stated that there were 4 in favor. Those were board members Chin, Hall, Joyce, and Booker.
I thought you said it passed. I'm sorry.
We have consensus,
Was that a consensus, but it's, there are 8 of us here, and there's only 4 who said yeah, and 4 said no.
my understanding, Board Member Hemmons, that you and also Board Member Beeman had not specifically said no.
Oh, I'm a no then.
Thank you. Board Member Beeman, if you wish to, give a strong yes or no to this, please.
Yeah. Board Member Beeman. Since this is going to rulemaking hearing and we will see it again and be able to have this exact discussion, so mark it on your calendars, people. That we're having now, and in that time, and as we reread these before the next meeting, maybe we'll come up with the right answer. Maybe we'll receive comment from rulemaking, so I will break the tie and say, yes, let's move forward with this. I know, but we will see it again. We will have an opportunity to edit it again, and maybe we can find out what and come up with language where it's just, yeah, so I will.
Council Tucker Davis.
I was just gonna make a suggestion, listening to the conversation. Would it take care of the concerns if it was to respond to adverse reactions and any other issues that may arise?
I will go around the room again, to address that. So Board Member Chin,
Board Member Chin would support that just to get it moved.
Member,
And to clarify, you just need to be present, and I can't imagine a professional pharmacist delegating to somebody who can't address an emergency, would say, yeah, just go for it, it's time, this is better on your mouth. That anybody would think that that was appropriate as a professional pharmacist.
Member Hall,
Remember Hall, I like adding the additional wording.
Member Joyce,
Board Member Joyce, yeah, I was thinking, any other questions that may arise, but issues, questions.
Member Griffin,
I like the added words, thank you.
Member Evans.
Board member. Okay, Board Member Hammond is okay with, I'm fine with the additional, private. I'll leave it at that until we get to the tax thing. Thanks.
Member Beeman,
Member Beeman, I like this language better, so I will say yes, let's move it.
Board Member Patel,
I remember, but yeah, I don't like it, that's okay.
Board Member Doyle, I oppose. Consensus is to move this language further to rulemaking as written. That is immediately available to the vaccinator to respond to adverse reactions and any other issues that may arise. Go back to Staff Member Davis, Board Member Joyce had some questions about monitoring. Is it your recommendation that that conversation take place in a different section of the rules?
I think it might be best if we tackle that when we get to the technician rules.
Thank you. There's a pin in that. Staff Member Davis, please continue with 0190290.
So in this rule is about record keeping and reporting. While there are many things that we could change in this rule, and they are addressed in the Division 115 rewrite, board staff again proposed to limit the changes to what is necessary to comply with the provisions of the new law. So we added the phrase after administers, we added or supervises each administration of, so that it can be the pharmacist administering or supervising the administration of a vaccine. So the pharmacist who does that must fully document the administration and the patient's permanent record, report the following elements to the OHA Alert Immunization System program, immunization program in a manner prescribed by OHA within 15 days of administration. I do want to propose in real time to strike the last two sentences of this. That's very old language that is not relevant in any way at this point. Paren, no changes to paren A, B, C, D, E, F. That's all just stays the same. And paren 3, just getting rid of the lead-in and saying keep documentation of current CPR training. Paren 4, follow storage and handling guidance. No changes to paren 5, minor change in 5B, and then changing paren, I think that should be, yeah, paren 6 to being part of C. Any board discussion on this rule?
Board Doyle, going around robin for, rule 0290. I think we're off Board Member Hemmings.
Surprisingly, Rosemary Hemmings has nothing. Yeah.
Member Beeman,
And I have no comment.
Member Patel,
Comment for now.
Member Doyle, no substantive comments. Board
Member Shin, no.
Member Hall,
Member Hall, no comment.
Member Joyce,
Joyce now looks straightforward.
Member Vipperman,
Member Vipperman, I just have a question. Has it always been within 15 days of administration? Okay, okay, so I'm good with that.
was that Board Member Beeman who nodded yes or something? All right, thank you. I pass it back to you, Staff Member Davis.
Okay, so now for the bell at the ball. 855-025-0024. This last rule is the proposed language to permit a COPT or PT to administer a vaccine. Again, from 2023 House Bill 2486, the new ORS 689645. Paren 1 reads, in accordance with rules adopted by the State Board of Pharmacy under ORS 689205. Paren A, a pharmacist or pharmacy technician under the supervision of a pharmacist may administer vaccines to persons who are 7 years of age or older, or B, if authorized by the governor or the director of the Oregon Department of Emergency Management or the public health director to a person age 3 and older. So the language we propose is a certified Oregon pharmacy technician or pharmacy technician may perform the physical act of administering vaccines under the supervision of an appropriately trained and qualified pharmacist to a person who is 7 years of age or older, or to a person who is at least 3 years of age when the governor declares a PHE or the public health director reduces the age limit. The proposed language is taken straight from the law, but makes it explicitly clear that it is only the physical act of administering vaccines that a COPT or PT can do. In paren 2, the COPT or PT must, prior to administration of a vaccine, receive practical training that includes infection control, recognition of anatomical landmarks, and competency in hands-on administration technique. Paren B, prior to administration of vaccines, hold an active CPR certification issued by the American Heart Association or the American Red Cross or any other equivalent program that is specific to the age and population receiving the vaccine, contains a hands-on training component, and is not valid for more than 3 years. So the training we've required in paren 2 is limited to these elements since 2023 House Bill 2486, I think I have the number wrong on my notes, does not permit a COPT or PT to practice pharmacy, and thus they cannot evaluate indications or contraindications for vaccines, and are also not permitted to respond to emergency reactions. In paren 3, they must document the vaccine administration, including but not limited to the vaccine administered, dose, expiration date, lot number, and injection site. Paren 4, notify the supervising pharmacist immediately in the event of a suspected adverse reaction to a vaccine. Paren 5, the training required in paren 2 may include programs approved by ACPE. And that should say, I think I added it, yeah, from an ACPE accredited college or school of pharmacy is what that should say. I'm sorry, thought I had added that. In line 234, staff member Melvin.
Sorry.
It's like a half thought. Include programs approved by ACPE, curriculum-based programs from an ACPE accredited college or school of pharmacy, state or local health department programs, training by an appropriately qualified practitioner, or programs approved by the board. And in paren 6, records and forms required by this section must be filed in the pharmacy, made available to the board upon inspection, upon request, and must be retained for 3 years. And I'm sorry we have this rule because the new universal rule is just not in place yet with this when we're working in Division 19 and 25. So I'm going to keep that rule. Board discussion on this rule. Back to you, President Doyle.
Board Member Doyle, thank you. I'll pause for staff member Melvin. Any concerns about computer technical issues?
Staff member Davis, you cut out a little bit when you were talking. I think it's her connection. I haven't heard from anyone else. Does she
Okay.
need to repeat any of the
Member-
portion?
No, I believe that it had cut out when she was just reading the text that we all have before us.
Yes,
I just wanted to pause to ensure you were good to go.
yes, it's being recorded. I think it was on her end.
With regard to 855-025-0024, I hand it over to board member Beaman for the feedback.
Member Beeman, it has most of the pieces I was concerned about. And so I look forward to other comments, but as of right now, I'm okay.
Member Patel.
Board member Patel, actually, I liked it, the number 5. So no comments for now.
Thank you, board member Doyle. No substantive comments or questions.
Member Chin has no comments.
Member Hall.
Member Hall. I just think it's interesting that they have to be certified in CPR, but they can't, recognize. Not expected, technicians aren't supposed to recognize an adverse reaction. Interesting.
Member Beeman.
Member Beeman, I liked that it was in there because if you do have an adverse reaction, the pharmacist then has another CPR trained person within the area. Because as it currently is, you may not have anybody else trained in CPR to help you. And depending on how long you're doing the CPR or if you're physically unable to, you do have somebody that you can direct to do it as part of that management, unless that's not our intent to have them help in that setting. But I think it's a huge safety plus just to have them, they're trained and certified. Even if they don't give the vaccine and the pharmacist gives the vaccine that the person reacts to, having someone else CPR certified in the pharmacy is a huge advantage for patients. So I was really happy to see that in there for that reason. They're not making the judgment, but they can help when needed.
Member Hall, thank you. I do like that they should have that. I just thought it was interesting that they can't recognize adverse reaction.
Member Joyce.
Yeah, board member Joyce, this touches on what, I was asking earlier. I'm just, trying to foresee a scenario where a technician gave the vaccine. And this goes south. That tech cannot respond directly to that. Must immediately get the pharmacist and then assist in the CPR. But can't directly respond to it, even though they have CPR certification. I am mildly okay with the language. But we don't want to overthink this, but I just don't want to see a case come up where the pharmacist was not immediately available and maybe the technician thought that the patient was having an extreme adverse reaction. I don't know. I don't have any suggestions, but it does, like I said, touch on what I mentioned earlier. Yeah. I'm good.
Member Berman?
Board member Whitman. Yes, I have.
Okay.
I was just reading the law and then perhaps the, council can, help me with, but I understood that, the law said a specialized, technician can do this. Is that, it did not say that. Maybe that was in the, testimonies that I read that. At the risk of being the odd man out, I am going to say what I feel about it. Is I think that it should read, that only a certified technician can perform the vaccines and not just a pharmacy technician. At least, and it has been my priority to say that I think that technicians should be educated in pharmacy. Going into something like this, I would feel better knowing that at least a national certification, they would be knowledgeable on pharmacy, on pharmacy law, on pharmacy, on, all the pharmacy things that we did too. And some of the programs that they have here that are approved by, I love the training. I love that we are requiring this kind of training. I love that it is, if nothing, it has to be board approved. This goes a great deal in my values as a technician, because I've always feared that technicians are trained individually by each individual company, and we don't really know how they're trained. So that is a good thing, but so my opinion is that a certified technician, the one to do the vaccines and not a pharmacy technician.
You had a question for,
Yes, I did.
Joanna.
Is it, I understood it was a specialized, technician.
So I drew up the bill, and so it's in front of me.
Yes,
And so we're looking at HB 2486.
correct.
And the first part reads, in accordance with rules adopted by the State Board of Pharmacy under ORS 689-205, a pharmacist, or a pharmacy technician under the supervision of a pharmacist, may administer vaccines, and then it has those ages. And then the other reference is in 3, the board is authorized to issue to pharmacists and pharmacy technicians who have completed training accredited by the Centers for Disease Control and Prevention, and it lists some other agencies, certificates of special competency in the prescription or administration of vaccines.
That's solid.
And then there's one other provision in section 2 that says the regulation of the administering by pharmacy technicians to the extent provided and ORS 689.64 of medications and drugs. And that's all the references to pharmacy technicians.
And that must have been the second one was, but I believe in the context of the testimonies, it was written in there a couple of times, so, but that's still my opinion and,
Board Member Evans?
Member Hemmings, so the legislature didn't necessarily say that the board has to give authorization to put, doesn't have to put this in rule that a pharmacy tech can administer vaccines. Says we could, doesn't say we have to.
Well, so it says in accordance with rules adopted by the State Board of Pharmacy under ORS 689-205, a pharmacist or a pharmacy technician under the supervision of a pharmacist may administer vaccines.
Board Member Hemmings, so it sounds like it's up to the board to make the determination if, let me see, if you want to put this in rule for pharmacy tech, or, but it says or, it doesn't say and.
Staff
that
Member Davis, the board is required to adopt rules in paren 1. But a pharmacist or a pharmacy technician has the option to administer vaccines. It's a may administer vaccines. We're not forcing anybody that they must administer vaccines, but we are required to adopt rules.
Board Member Hemmings, I get that. I guess the question I'm asking is if we just said in paren 1, paren 1, a certified Oregon pharmacy tech may perform the physical act of administering vaccine and didn't have pharmacy tech, would we be in compliance with the actual legislative statute? Whatever that was.
This is Joanna Tucker Davis. That's not a question I'm prepared to answer today. If you would like legal advice on that, you could. I would note that this does become operative on January 1st.
Member Beeman?
Not done.
I'm sorry?
Okay, so Board Member Hammond, so I'm trying to understand Board Member Vipperman's opposition to having pharmacy techs do this. I'm confused because Board members' opposition to this signaled to me that we have an option to not include them. But based on what I'm hearing, I'm just trying to clarify, does the board have an option to not include pharmacy tech, yes or no?
Member Vipperman?
oh, this is Board Member Vipperman. It's not an option not to, include the pharmacy technician. What I'm asking is that the pharmacy technician have a national certification.
Okay.
That's what I'm asking is that, and a national certification is a certificate saying that you have done this course and you have passed it. It's nationally certified. A lot of states have it. We had it until February of last year when the board decided that we needed more technicians. And now I am concerned that technicians are not getting trained. So.
Board Member Hammond, thank you for clarifying that for me. I appreciate it. But so now my next question goes back to what I said previously around this issue of under the supervision of an appropriate trained and qualified pharmacist. Is this active or passive supervision?
Staff Member Davis, give you first option to comment here.
The only thing I can say is go back to the definition of supervision by a pharmacist that I read earlier. Being stationed within the same work area, except under telework roles, as the intern certified Oregon pharmacy technician or pharmacy technician who is being supervised, coupled with the ability to control and be responsible for the intern certified Oregon pharmacy technician or pharmacy technician's action. To me, that sounds active since it's the ability to control.
Remember Hemmings, yeah, that's an assumption. For number 4, where it says notify the supervising pharmacist immediately in the event of suspected adverse reaction to a vaccine. But they have to be CPR certified. They're not allowed to initiate CPR in the event someone goes into cardiac arrest without without being specifically supervised, which is active supervision, to initiate CPR. That's how I read this. Is that correct?
That's the way the law was written.
Okay, thank you.
Board Member Doyle, if I'm not mistaken, we have a Good Samaritan law in Oregon. And that if anyone, if they, which would preclude any other laws if a, in this case, a technician would begin life-saving procedures for an individual. Member Hemmings, any further questions or comments?
No, thank you.
Member Beeman?
Thank you, Member Bean, and during Board Member Bipperman's comments, I had the same question of, do we have the authority to specify certified technicians versus non-certified technicians? So in reading the House bill, it doesn't say, and I know sometimes the definitions and language used are different between what the intent is and what actually shows up on the page. And then in just a question to Board Member Bipperman, when you say you kept using the term specialized, do you not find whether a technician is certified or not certified that the training that they have to go through in order to give vaccines that we're outlining in these rules, would you not consider that specialized? The training's not going to be different for anybody giving vaccines within a pharmacy. Well, the pharmacist training, I'm assuming, is going to be the same as the technician training in terms of the administration.
Board Member Bipperman. I don't know. I will have to think about that.
And I just remember I have one other question that Board Member Chin may have, just for perspective, but she may have more knowledge on. I believe, and I could be very wrong, that currently medical assistants are not licensed in the state of Oregon. They work under the license of their person overseeing them. Is that correct? Yeah, they can give vaccines. We currently have, and I know it's not under our purview, but we currently have non-licensed people in other settings giving vaccines. So I think even if we don't have the option or the authority to specify certified versus non, we are still, and I don't know the requirements. I'm not trying to put down any other professions. I'm just saying we have a licensee under us that we know exactly what their training is going to be to do this. And that alone makes me comfortable with what we're outlining here. But I do see your point on certified versus not, because it is a different, can be very different depending on how people look at their jobs and their tasks.
Board Member Patel, I would echo what Board Member Beeman said. I agree that you will get specialized training. PTCB is not going to give that immunization training. So I agree with that. And same with the medical assistant too. And with the CPR, I do agree that if you have CPR, and to be honest with you, you don't have to be healthcare professional to get the CPR certificate. Like, you don't need someone's permission to save someone's life, like Coast Guard, fire department. Even if you're not working in that profession, you can have the CPR certificate and you can save someone's life. And I do personally believe you don't need a doctorate degree to see if someone is choking and get the, chest compression. So I think in that event, yes, technician can start with the CPR.
Member Doyle, I've lost track of where we had started. Board Member Chin, did you have an opportunity to speak already?
Board member Chin has lost track too, but I definitely echo board member Beeman's comments. I think that the specialized training that one would get as a pharmacy tech or a CPT would be equivalent. And it's a task. It's not the whole entire training of the CPT. So I think an additional training of either level of tech is just specialized procedure or task. It's just another task that you can receive specialized training to do, and I'm comfortable with this.
Realize I skipped myself. I don't have any substantive additional information to give to this. Board Member Hall, were you given a chance to speak on this?
Overall, I'm good. I have no more comment.
And I think you started, maybe. So do you have additional comments after the round robin now?
More, Joyce, just one quick thing. PTCD does offer certification specifically to vaccinations. And I do share Board Member Vipperman's sentiment. And however, I don't want to restrict the number of available pharmacy technicians to be able to give vaccines. At baseline, the CPR is good. And the Good Samaritan comment also covers some of my concerns from the previous question. Thank you.
Board member Beeman, you started with me on this one.
So if I started with you, Board Member Vipperman, we have
I do not have any other comments other than the comments I've made.
Board Member Hemmings.
Member Hemmings, I just want to say that, some rules are written with the audience who intended audience is a licensee. And sometimes it's a licensee and the public. And I would say that, this rule regarding the vaccines, the public has a stake in this as well. And I think I've shared here on the board before that my personal experience in receiving vaccines, that it makes a difference who gives me the vaccines. I know that, it's been said here that it's simple, but I know that, some people do it well where I'm not in a lot of pain and discomfort, and some people don't. And I just think that's important that we get this right because the public will be impacted by this.
The floor is open for any additional comment or question. Seeing and hearing none, I would like to suggest that we take a break now since it's 10:45. Is that okay with you, Staff Member Davis?
Sounds great.
So it's 10:46. We'll resume discussions at 11 a.m. Thank you.